Now we're also going to want to look at a number of other markers. We may look at hormone panels. We may check for signs of GI permeability, okay? Meaning we look for what's called leaky gut syndrome. As I mentioned earlier, if you're consuming foods that you're allergic to, it actually will burrow its way through your gut lining. Like we mentioned before, your gut controls 80% of your immune system. And so you can actually be shooting yourself in the foot by eating these foods that you don't even know are a problem. But with leaky gut, you actually get these holes in your gut lining that allow large proteins to leak into your bloodstream. Once those foods are in, or those proteins are in your bloodstream, your immune system does not recognize that and it starts attacking that. Okay, and so again, very, very important to distinguish. If we're suspecting, because of your white blood cell panel, any parasitic infection, we oftentimes run a microbiology assessment to look for any signs of parasitic, viral, bacterial infections that are prominent in the gut lining. And so you can see from the number of tests we run, it's very, very important to establish this baseline as of what's going on with you metabolically, because there can be, and there always are, a number of these components that are helping to promote your inflammatory pain condition, which is also known as fibromyalgia. Now, the second thing that we talked about checking and needing to treat successfully is your brain. What we know is that in fibromyalgia, there is a neurologic imbalance in brain function. Okay, let me grab this model here. So we have a number of different areas of brain function. We have the frontal lobe, the parietal lobe, which sits right back here, the temporal lobe, the occipital lobe sits back here, and then the cerebellum. Of interest to you is really the cerebellum in the frontal lobes. What we know is that the cerebellum is responsible for your balance, for your coordination of movement. It's also responsible for all your spinal postural muscles. And what we regularly find in our patients that suffer from fibromyalgia is that they have cerebellar dysfunction on one side of their body. What happens is the cerebellum fires very powerfully to the opposite side frontal lobe. The frontal lobe then fires down into the lower brainstem, okay, specifically in the pons. And the pons also fires up into an area of the brain called the mesencephalon. And it helps to inhibit or quiet down the activity of the mesencephalon. The mesencephalon I like to compare to a mouse. A mouse has a mesencephalon. And so when you look at a mouse and you see its eyes darting and the way it's kind of always got a little tremor in its step, it's very, very anxious. Okay? This is what your mesencephalon does. Now, the reason you don't see this in the average human so prominently is that we have these frontal lobes, which that mouse doesn't have. And these frontal lobes help to supervise or watch over that mesencephalon. But what happens is when we have a weakness in the cerebellum that leads to a weakness in the frontal lobe, that mesencephalon begins to start to overfire. And when that mesencephalon begins overfiring, it promotes inflammation in the body. It promotes an increased sensitivity to pain. It makes it very difficult to get restful sleep at night, which leads to chronic fatigue. So you can see many of these symptoms that you've been suffering from really stem from a neurologic imbalance in brain function. So what do we do for that? Well, what we do is we assess neurologic function using functional neurologic evaluations in our office. So we're actually going to assess and find areas of decreased brain activity. The cool thing about this is that when we perform the test, you'll be able to see for yourself that you're not able to do some of these tests as well as you think you should be able to. And so you'll be able to see for yourself where you have these brain imbalances. Now, what do we do once we find out, for instance, that your cerebellum is not working properly? Well, what we do is we use brain-based therapy. It's a revolutionary treatment that is literally rewriting the books on healthcare for many of these chronic conditions. Okay? What we do is we apply traditional chiropractic medicine in an alternative style, I should say. So we use adjustments. We use a lot of those things to drive normal brain function. But we also use a number of brain-based therapies that can include eye movements, olfactory stimulation, smelling things in the nostrils, different activities that will stimulate and drive brain function. We can use warm water calorics. So if we pour warm water into your ear, what it actually does is it stimulates the same side cerebellum. So there's a number of different things that we can be doing to help drive proper brain function. We basically rebalance this activity within the brain, bringing balance back to your system and allowing you to inhibit those pain signals that are overfiring in your body. Now again, this all depends upon the treatment for both. We have to address that metabolic side and this neurologic side in order for you to get the results that you're looking for. Now, in wrapping up things, what I want to do is I just want to ask you a few questions. Number one, what does your fibromyalgia cost you in time, in money, in sleep? How has it affected your relationships with your friends, with your family? Where do you see yourself in the next 1 to 5 years if you don't do anything to get this fibromyalgia under control? And finally, what is it worth to you if we could end your suffering today? Ask yourself those questions. If you feel that it's absolutely imperative that you get this corrected, which for most fibromyalgia patients, I think that they want help, they just don't know what to do to get it. If you feel that you would qualify and want to check in to see if we can help you, by all means, what I want you to do is call our office and get scheduled for a consultation with myself where we can review your case, we can review any lab work that you've had done in the past, and we can also do a screening evaluation, a neurologic screening evaluation to find out if your fibromyalgia can be helped, if you qualify for care in our office. To be honest, we do not accept all patients. We only accept those patients that we feel that we can help and that we feel are committed to getting better. And so please, do call our office. Our office number is 763-398-7770. I would love to sit down with you and see if we can help change your life. So thank you so much for taking the time to watch this video, and we look forward to seeing you in the office soon. Thank you.